And we're going to take you live now to Melbourne, where Federal Health Minister Mark Butler is speaking.
Head of the WHO has reiterated their view that these measures are, to use their words again, understandable in light of the lack of comprehensive information about the situation in China. It's really important that the rest of the world have as much information as we possibly can get about this fast developing COVID wave in China. Happy to take questions.
Why did you go against the advice of the CMO on this test requirement?
Well, the 4 recommendations from the Chief Medical Officer that was contained in the advice that I decided to publish on the same day I made this announcement on New Year's Day, on the 1st of January, are all being implemented by the government to look at the feasibility of wastewater testing from airplanes arriving from China. We started a pilot of that on the 3rd of January. We're getting great buy-in, great cooperation from the airlines and from state governments to do that wastewater testing off aeroplanes. You will also have seen in recent days European nations and the US look at that as well. We also accepted the recommendation from the CMO to look at strengthening community wastewater testing, so wastewater testing here in Australia, and we've had again really good cooperation from state governments with several new community wastewater testing sites agreed only in the past couple of days. Other recommendations from the Chief Medical Officer in the advice that I took the decision to publish at the same time that we made this announcement have all been accepted and are all being implemented. But I was also clear at the time that in light of what was happening around the rest of the world, pretty much every country to which we would usually compare ourselves is putting in place these requirements, in light of the World Health Organization advice that was being released at the time that the Chief Medical Officer's advice was being sent to me, that these were understandable measures, I also took the decision to put in place the pre-departure testing arrangements.
The Chief Medical Officer nevertheless said that he didn't believe that there was sufficient public health rationale for this decision. Your government's made much of following the health advice when your own chief health bureaucrat is telling you that there's not sufficient rationale for this decision. Why do you ignore him?
And I've accepted every positive recommendation contained in the advice. We value transparency. That's why I took the decision to publish the advice in full on the day that I made these announcements. Of the 4 recommendations made by Professor Kelly, I'm implementing all 4. If I decided not to implement some of those recommendations, which he had said were important in terms of getting better understanding of what's happening here in Australia, there would have been a valid criticism. But I have accepted all 4 recommendations from Professor Kelly. Now, in addition to that, I, as the relevant minister, and the government more broadly, have taken the decision, as has been taken by pretty much every government to which we would usually compare ourselves, a decision described by the World Health Organization as understandable, out of an abundance of caution, to put in place pre-departure testing.
Federal Health Minister Mark Butler there talking about the travel rules affecting travellers inbound from China to Australia. He mentioned that we need as much information as we can get. Talked about the wastewater testing. We will be live to the AMA shortly with more on this story.